Okay, so we've got this really interesting collection of research on osteoporosis you sent us.
Yeah.
It seems like you're trying to get like a complete view of this, right?
Right.
From the science behind it
Right.
to like practical advice from the Mayo Clinic.
Yeah.
Even how they're putting together educational materials for
Pretty
patients.
fascinating.
We even have a study from India on lifestyle changes for postmenopausal women.
Right.
Talk about real-world
Yeah,
stuff.
for sure.
By the end of this deep dive,
Yeah, okay.
you'll not only understand how osteoporosis develops,
Uh-huh.
but you'll also be able to like make good choices
Right.
about prevention and treatment options.
Yeah.
We'll even get to some areas where the science is still, figuring things out.
Absolutely. What's really interesting here is how these sources go beyond that simple estrogen deficiency explanation we always hear,
Yeah, exactly.
It's more than just that.
So let's start by zooming in, like way in
Okay.
at a cellular level.
Right.
Imagine your bones are like a busy city, constantly under construction and demolition, right?
Yeah.
The construction workers are these cells called osteoblasts.
Yeah.
They're building up the bone tissue.
Right.
While the osteoclasts are like the demolition crew,
Yeah. The wrecking crew. breaking
down the old bone.
Yeah, I like that analogy. So
Yeah.
in a healthy person, these processes are balanced.
Right.
But when the demolition crew,
Gets a little too excited.
gets a little too enthusiastic, outpacing the construction, that's when bone density goes down. And
Wow.
we start to see osteoporosis.
So it's this imbalance, right?
Yeah.
That sets the stage.
Yeah.
But it's not just about age and hormones.
No, absolutely not.
There's got to be more to it.
There's a lot more going on.
Wow, what else is going on?
Well, one of the most exciting areas of research is osteoimmunology.
Okay.
It's the connection between the immune system and bone health.
Okay, so our immune system
Yeah.
is doing more than just fighting off infections.
More than just fighting off colds.
It's like a key player in our bones, too.
It is. It actually regulates bone density.
That's amazing.
And this is where this idea of inflammaging comes in.
Okay, inflammatory.
As we age, our bodies experience this kind of gradual increase in low-grade inflammation.
Like a low hum.
Yeah, think of it like the city's infrastructure, slowly wearing down over time.
Oh, okay.
And this chronic inflammation can disrupt the balance in our bone city.
Right.
It favors the demolition crew.
So it's not just about getting older, it's about how our body handles the aging process at like a cellular level.
Exactly.
It makes you think about like those lifestyle choices that impact inflammation,
You're right, and there's another layer to all of this.
What's that?
The gut microbiome.
Wait.
All those trillions of bacteria living in our gut.
The bacteria in our gut affects our bone.
They can influence bone density, yeah.
How does that even work?
Imagine the gut as a marketplace, right? It supplies building materials to our bone city.
Okay.
The gut microbiome affects how well we absorb nutrients like calcium.
Right, which is crucial for bones.
And those gut bacteria produce molecules that can act like messengers, directly affecting those construction and demolition crews we talked about.
It's like a whole ecosystem
It is.
impacting our bone health. So what we eat
Yeah.
is not just nourishing us.
Right.
It's feeding this like complex world in our gut.
Exactly. And it's all connected.
It makes you realize how interconnected everything is.
And then there's cellular senescence.
Cellular senescence.
As cells age, they can become like those grumpy old residents in our bone city.
Okay.
They stop working properly and release these inflammatory signals that mess up the balance.
Oh, so it's inflammation again.
You're seeing a pattern here.
Yeah, it seems like a theme in all this research.
Inflammation is definitely a key player in osteoporosis, and targeting it could be huge for future therapies. But before we get too lost in the cellular world, let's zoom back out and talk about what you can actually do to protect your bones.
Okay, yeah, let's talk about that.
This is where it gets really interesting, because you're not just a bystander in all of this.
Right.
You can really make a difference.
So what can we do?
Well, your source from the Mayo Clinic has some great advice.
Okay, what do they say?
They emphasize that exercise isn't just about fitness.
Right.
It actually strengthens your bones.
So it's like giving your bones a workout too.
Exactly. Use it or lose it. Right.
Makes sense.
And the Mayo Clinic specifically recommends a mix of exercises.
Okay, like what?
Weight-bearing activities like walking or jogging,
Okay.
aerobic exercise,
Okay.
muscle strengthening exercises,
Got it.
and even low-impact exercises like Tai Chi.
Really?
It's all about keeping those bones active and stimulated.
That's good to know.
Yeah,
Feels empowering, like I can do something,
exactly. You have the power to protect your bones.
And of course, we can't forget about nutrition.
Of course not.
Everyone always says calcium and vitamin D.
It's essential for bone health.
How much should we be getting?
Well, the Mayo Clinic recommends about 1,200 milligrams of calcium daily for most adults with osteoporosis or osteopenia.
Osteopenia.
That's the stage before osteoporosis.
Got it.
You can get calcium from dairy products, leafy greens, fortified foods, or supplements.
Okay, and vitamin D.
Sunlight, fatty fish, or supplements.
Okay, so a balanced diet and lots of sunshine. Got it.
Sounds good.
But what about the stuff we know isn't good for us, like smoking and drinking?
If you remember that inflammaging idea,
Right.
these habits just make it worse.
They add fuel to the fire.
Smoking increases bone loss and makes it harder to absorb calcium.
Okay.
And too much alcohol interferes with bone formation.
Oh, wow.
And makes you more likely to fall.
Which can lead to fractures.
Exactly.
Okay, so it's about like adding good things and subtracting the bad.
It's about finding a good balance.
But what about genetics? Are some people just like predisposed to weaker bones?
Well, genetics do play a big role.
How big?
They account for 60 to 80% of an adult's bone mass.
Wow, that's a lot.
Your genes can really influence your bone density and your overall risk for osteoporosis.
So even if I do everything right, my genes can still like mess things up.
It's possible, but that's where understanding your own risk factors is crucial.
So like family history?
Yeah, family history, ethnicity, and other personal risk factors.
That helps you and your doctor create a plan.
A prevention plan that works for you.
Okay, I get it.
Did you know that non-Hispanic, white, and Hispanic American women are statistically at higher risk for fractures?
I didn't know that ethnicity played a role.
It's all part of this complex interplay of factors that contribute to osteoporosis.
It's complicated.
It is, but even if you have certain genetic predispositions, lifestyle changes can still make a huge difference.
That's good to know.
It's about understanding the hand you've been dealt and playing it strategically.
I like that.
Yeah,
So we've explored this cellular world of osteoporosis, right?
we have.
And the power of those lifestyle interventions.
Right.
But how do we even know if we have this, like, silent disease?
That's a good question.
That's where diagnosis comes in, right?
That's where it starts.
So how do we do that?
Well, one of your sources talks about this.
Take
It
her.
starts with the bone density scan.
The DXA scan.
Right. It uses low-dose x-rays to measure bone mineral density,
Where do they do it?
usually at the hip and spine.
So it's like a special x-ray for bone density?
You could say that.
And what happens then?
They give you a T-score.
A T-score,
It compares your bone density to that of a healthy young adult.
like a benchmark.
Right. A good T-score means strong bones, and a lower one might signal a problem.
So it gives you an idea of where you stand.
Yeah, but diagnosis is more than just that number.
Okay, what else is there?
It's about looking at your risk factors, your medical history, and any symptoms you might be experiencing.
So it's not one size fits all.
Everyone is different.
It's a personalized picture of your bone health.
Precisely.
And speaking of personalized care, one of your sources mentioned something called a fracture liaison service.
Oh, the FLS?
What's that?
Think of it like a specialized team that steps in after a fracture.
Okay.
They make sure you get the right diagnosis, the right treatment, and the right support.
So it's like a safety net
You could say that,
after a fracture.
but here's the thing.
Right.
The FLS recognizes that a fracture, especially in older adults, can be a red flag for osteoporosis.
It's like a wake-up call.
It is. It's not just about fixing the broken bone. It's about addressing the underlying cause to prevent future fractures.
I see. So they look deeper.
They do. They connect patients with specialists like endocrinologists or geriatricians to really assess their bone health.
And come up with a long-term plan.
Exactly.
That makes a lot of sense.
Yeah.
A broken bone is a serious signal,
It shouldn't be ignored.
and the FLS is making a difference.
It is. Studies have shown that these programs are really successful in reducing secondary fractures.
Secondary fracture.
Those that happen after the initial one.
Okay.
It's a proactive approach to care. It's changing how we manage osteoporosis.
Wow, it sounds really valuable.
It's a great resource.
So we've covered the initial diagnosis. What's next? What kind of treatments are available?
That's where we delve into the world of osteoporosis medications.
Okay.
And your sources give a good overview of the different types of drugs available,
Like what?
both anti-resorptive and anabolic.
Anti-resorptive versus anabolic.
Yes, the difference.
Yeah, what is the difference?
Well, remember those construction and demolition crews in our bone city.
Yeah.
Anti-resorptive medications basically put the brakes on the demolition crew,
Okay.
slowing down the breakdown of bone tissue.
Okay.
And anabolic medications boost the construction crew,
Okay.
stimulating new bone formation.
So it's like a two-pronged approach.
You got it.
Slow down the breakdown and boost the building.
Exactly.
It's like it.
So what are some examples?
Yeah, what are some examples of these medications?
The most common are anti-resorptive drugs.
Okay.
And within this category, bisphosphonates are the most widely used.
Bisphosphonate.
They've been around for a while and have a proven track record in reducing fracture risk.
I've heard of those. Aren't they the ones with specific instructions on how to take them?
You're right, there are some precautions.
Okay.
For example, bisphosphonates are best taken first thing in the morning on an empty stomach with a full glass of water,
Okay.
and staying upright afterwards is important.
Why is that?
to prevent the medication from irritating the esophagus.
Oh,
It's a bit of a ritual,
yeah.
but it helps.
It makes sense.
Are there other types of anti-resorptive medications?
Yeah, are there?
There are selective estrogen receptor modulators,
What are those?
or SERMs for short.
SERMs, okay.
They act like estrogen in certain parts of the body, including bone,
Okay.
but